how do you determine how deep you?
Oh well, I mean, if you go too light, it'll almost be ticklish. You can't go too light, then you're just like scraping the surface. So you go deep enough where it's like we like to say like a good hurt, where you don't want it more than like I would say a 3 to 4 out of 10 in terms of pain scale, with 10 being the worst. So if it's like a 3 to 4 out of 10, that's probably good. Any more than that might be a little too much. You want to back off, but it's gonna hurt a little bit, but it usually feels better like within the next day or 24 hours. So.
Well, what's interesting about gua sha is that it is an ancient form of Chinese medicine, where I use, instead of surgical steel, I use a piece of buffalo horn or a piece of jade. And in some countries they call it coining, where they'll use the edge of a coin. So it's an old folk medicine that was brought back into light by, I think it was a chiropractor whose last name was Graston. Right?
And a lot of physical therapists use it too. But Graston's probably the most popular, newer named one. And they have a bunch of different tools, not just one. There's all different sizes and shapes depending on what area you're working on.
Spend a lot of money.
It's very expensive, but there's like big handlebar looking ones if you're working on the big muscles. There's smaller ones that can work on the hands and feet, or but there's it's
another form of myofascial release.
Right.
Any adhesions, the fascia can get very sticky, and if you don't, you want to restore the slide and glide of the fascia, of the myofascia, because it's a double layered bag that surrounds each muscle, and it can become adhesive from trauma or from lack of movement.
So that's what.
And so you're basically releasing those tissues from the outside in, where a pin and stretch or ART is releasing it from the inside out.
So this is basically instrument-assisted soft tissue therapy, is kind of like the name for it. So.
It also helps with blood flow.
Now, when someone comes to you with chiropractic, I can understand it. I have a back pain, and when someone comes for acupuncture, how do you determine where? Do they come with a specific pain already, and so you can determine from there what they need to do, or do they go through a checkup here first, a total checkup, and then it's determined what needs to be worked on?
An assessment needs to be done, and because it's a musculoskeletal condition, we do an assessment. So it will be a movement assessment or a postural assessment. Things like orthopedic tests are used to confirm the idea. They usually come in if they're referred from a doctor, and they'll come in and say, "Oh, I have degenerative back disease," or they might come in and just say, "I have low back pain." And if I see that it might be something other than an acute issue, I might refer them to Dr. Connor, or refer them to an orthopedic doctor. I think it's a little more than something that I can take care of. But I manipulate, lack of a better word, to the soft tissues, and that's what the needles will do. The needles help relieve the pain. It helps restore function in the area. Also help release tissues, so that when I apply manual therapy, I can centrate a joint. I can help mobilize a joint or increase range of motion.
And I'm manipulating more of the joints, and they would come in, when they see me for consultation, I would do assessment, evaluation, make a diagnosis, and develop a treatment plan. And if it's something out of my scope, I'll refer out to somebody else if need be. But usually I can treat most neuromusculoskeletal pain, whether it's neck pain, back pain, headaches. There are things obviously that might need referral to orthopedic, maybe needs drugs or surgery or an injection or that type of thing.
Yeah, I'm not, in my scope of practice, I do not make Western medical diagnoses. I'm not trained to do that. I can make an assessment or an evaluation a biomechanical evaluation, or from a Western perspective, or I can make a Chinese medical diagnosis, which then is a whole paradigm and thought structure on then how to go about treating it based on that Chinese medical diagnosis. So I even with evaluation, I sort of integrate the two to give to better understand the patient, because I grew up in a Western culture and learned an Eastern medical art. It's hard to not integrate the two. So I think that's important, and that's happening in China it's a very progressive medicine, acupuncture. It's not. They don't keep it in its ancient form. It's always progressive, and I think that's an issue that
Which would make sense.
that happens around here. Some people try to stay very pure, like they won't use ice because it wasn't around. Well, but it is, but it works and it's needed. So I don't know if everyone's doing it, but I remember back in school there were people being very purist with the acupuncture.
There was once upon a time no Novocaine either, and they put it in.
Yeah.
I don't want that pure.
Right. Yeah. Yes.
How deep do the needles go?
Oh, well, it depends on what I'm
And do they hurt?
Well, see, I have techniques on, it depends, right? It depends. So if I'm doing a musculoskeletal, if I'm releasing a trigger point, an active trigger point, and I palpate and I feel it in deeper layers of muscle, I have to reach that trigger point. So it can go in up to an inch, but it's usually
Did I hear? That was
95% of the time. 95% of the time, it's very shallow. So I'm again integrating from an energetic perspective, right? And if you don't like the word energetic, then it could be a neuroendocrine perspective, a myofascial perspective, and again, it depends. But yeah, if a patient is phobic of the needles, or they're very stressed out,
No, I'm saying then they see
Oh,
me.
no.
Oh, then they say, right. But I work with the patient, again, and there's techniques. Before I put the needle in, I'll stimulate the area, and they usually don't feel it. So again, it depends. Any other questions?
I had a question about the electroshock therapy. You guys said it worked for plantar fasciitis.
Yes.
Does it just like relieve the pain, or does it like totally get rid of it? Like, does that ever go away?
Yeah, it's hard to say what the exact mechanism is. So these shock waves, it's the
Yeah, you're talking about the electric, not
Which one?
electric shock
The
therapy, or the
The one that had the picture of the foot.
extracorporeal
shockwave
shockwave therapy.
Okay.
Yeah, it sends with these mechanical shock waves. Like if I took a rock, right, and I threw it into a pond, it's the ripples that the body's getting is receiving, right? It's not the rock itself.
Right.
And so these ripples can, one of the first things I think of, it releases any type of lesion, any type of bound up tissue. In fact, it can even irritate the area, but if it releases the tissues, then you regain that range of motion, and then it sets it, it resets it, so it needs to still heal, and then we might use another therapy to help with the healing process. But it helps release the tissues and sets the healing in motion, because you're ultimately the one who heals. What we do is we're just a catalyst to get you to do what you ultimately do and heal. And sometimes the body is in a state of hyper-functioning or hypo-functioning, right? But it's always looking to maintain homeostasis or or dynamic equilibrium, or from a Chinese medical yin and yang, whatever you want to call it. The body's always in flux, right? All the systems are working as you're sitting there. You're digesting. So your digestive system is in a state of homeostasis. But what is the key to maintaining homeostasis for all the systems is your neurological system. Your nervous system is, your central and your peripheral nervous system is the number one system to help regulate all the other systems. So and again, we don't know what the mechanism is of acupuncture. We think there's many different mechanisms. But one of the key mechanisms, if you could stick a needle in the foot and it affects the head, we think that there's something to do with the nervous system, and it's communication.
Yeah. So basically, the shockwave can help with the plantar fasciitis, but if you have other factors like flat feet, or if you continue having an improper gait, then it might just return back. So you'd have to kind of solve all the other problems. Whether you maybe have a short leg.
Why did it happen in the first place?
Right. Maybe the short leg, or maybe like I said, your gait, or your stance, your form, or your posture is wrong. So yeah, the shockwave might help with the pain initially, but the plantar fasciitis might return if all those other things are still ongoing. So almost everything has to be kind of resolved for it to completely go away.
So these are all the things we check. It's not just take care of, we want to get to why it happened in the first place. It's the functional aspect of the medicine, the holistic aspect of the medicine, right? Because if you're doing something proper, we have to counsel on that.
Right.
We have to find out what it is. It could, like he said, it could be hip issues, so it's from the hips down, or it could have just been bad foot, a dorsiflexion issue in the foot, whatever. Anyway, I go off on tangents here.
All right. Any
Any questions?
No.
We're all set.
Yeah. Thanks,
All
guys.
right, good. All right, thank you.
Thank you.